Hey everyone, and welcome to today's Explainer. Today we're putting on our patient advocate hats to help you and your family navigate the literal life or death realities of diabetes care and specifically the staggering costs attached to it. Now, managing diabetes is incredibly complex just on a medical level, right? But the financial burden, that is a completely separate, massive hurdle. So we're going to break down exactly what's happening in the healthcare system right now, the huge shift in what's actually driving up your costs, and most importantly, how you can navigate this maze to find the affordable care you absolutely deserve. Right off the bat, we have to look at this jarring reality from a recent 2025 Yale University study, because validating the intense, everyday struggle of managing this disease is exactly where we need to begin. This isn't just some abstract economic debate, it's a very real human crisis. People are actively skipping doses, they're cutting their injections in half, or they're just going without their life-saving medication entirely, simply because they can't afford it. They've rationed, and tragically, some have died. And when you zoom out to the macro level, the numbers are just absolutely staggering. The total estimated annual cost of diagnosed diabetes in America sits at $412.9 billion as of 2022. I mean, to put that into perspective, that's a massive, massive portion of our entire healthcare economy, highlighting the immense systemic weight of the disease. And the crazy part? That number just continues to climb year over year. But we have to remember that behind that $400 billion price tag are real people. Looking at the Centers for Disease Control data for 2026, we see that over 40 million Americans are living with this condition. 40 million! That's millions of families constantly doing the math at the kitchen table, trying to figure out how to afford their next pharmacy trip just to survive in this incredibly expensive system. So here is our advocate's playbook for today's explainer. We'll quickly run through. 1. The reality of rationing. 2. The new cost crisis. 3. Navigating manufacturer savings programs. And 4. The affordability checklist.
All right, let's jump right into Section 1, the reality of rationing.
Get this, between 2012 and 2022, insulin spending in the U.S. nearly tripled. It went from $8 billion to over $22 billion. That is a shocking jump when you stop and consider that the core formula for insulin hasn't actually changed in decades. It's this exact escalating financial pressure that's been forcing people into those impossible choices, like skipping doses. And as that 2025 Yale study confirmed, this rationing is absolutely still persisting today. Which brings us to Section 2, the new cost crisis. Now, historically, insulin prices were the primary financial wall that patients hit. But today, the landscape has totally shifted. It's a whole new ballgame. Expensive devices, think continuous glucose monitors and insulin pumps, along with the newer class of GLP-1 medications, are dramatically reshaping patient spending. These innovations are incredible, for sure, but they've become the new massive financial hurdles for patients trying to effectively manage their health. And here's the rub. Millions of people who are uninsured or underinsured are falling through a massive policy gap. Yes, policy is improving in some areas, like Medicare finally capping insulin costs, which is great. But if you fall outside of those specific protections, well, you're left to navigate an incredibly complex, expensive system mostly on your own, making this crisis an ongoing, life-threatening reality every single month. So, what do we do about it? Let's get into Section 3, Navigating Manufacturer Savings Programs. You might want to grab a pen or take a screenshot of these because, honestly, you practically need a master's degree to navigate the healthcare system right now. But knowing these options could literally save your life this month. If you're on Medicare Part D, your insulin is capped at $35. But look at the private options. Lilly offers a $35 a month cap with zero application or income threshold. Novo Nordisk has free or $35 options for eligible uninsured patients. Sanofi has a $35 program, and Walmart offers Rely-On for $35 or less right off the shelf. The programs are out there. It's just about knowing where to look. And hey, another huge tip, talk to your pharmacist about biosimilars. This is a real game changer for unlocking immediate, practical discounts. Biosimilars are highly effective alternatives that work just like the brand name versions, but they are typically 15 to 30% cheaper. It's kind of like buying the generic version of a drug. It keeps more money in your pocket, so it is absolutely always worth having that conversation at the pharmacy counter. And we actually have proof that policy protections and caps genuinely work within covered systems. Just look at the data. Average out-of-pocket costs for Medicare Part D beneficiaries successfully plummeted from about $51 down to $22 for a 30-day supply between 2019 and 2023. It just shows that when systematic limits are applied, the financial burden on the patient really does drop.
All right, let's wrap this up with Section 4, the Affordability Checklist.
I want you to treat this like your personal playbook. Follow these exact steps. Step 1, ask your doctor about biosimilars. Step 2, hunt down and use those manufacturer assistance programs we talked about. Step 3, compare pharmacy prices on apps like GoodRx. And Step 4, aggressively verify your eligibility for any aid you can find. Never, ever assume the first price they give you at the register is the final price. Check apps, ask questions, and be relentless about advocating for yourself. As we close out this explainer, I want you to remember one absolutely crucial thing. Managing diabetes is hard enough. The cost should never, ever stop you from getting what you need to survive. So please, consult your doctor, share this checklist with someone who might need it, and take action today. You deserve affordable care. But it does leave us with a pretty critical question moving forward. Will our healthcare system finally evolve to put patients over profits, or are we going to continue forcing millions of families to treat financial navigation as a second full-time job just to stay alive?